Hydrocephalus is a condition that is characterized by enlargement of heads among infants. But what is it that you've heard about this condition? Many people think that children with hydrocephalus are cursed because of the buildup of fluid in their brains. Others may think that immediately these children will not have a chance after they are born. Kevin Mukundi Yukuri was 8 months pregnant when she found out her baby she was carrying had a condition called hydrocephalus, a condition that was at the time strange to her. She narrates to us her experience.
Hanyuma indimaze kugira amezi 8 nibwo nasubiye kwa muganga.
When I was 8 months pregnant, I went to hospital, did a scan, and then told me that my baby had an abnormality. They said she had excessive fluid in her brain. They decided to operate on me because most of the time I was also unwell. When I was operated, they told me she had fluid in her brain, but also she had a tumor that was sitting on her spine. So I was referred to King Faisal Hospital, where she underwent brain and spinal surgery. It was a trying time at home because we spent a lot of money on treatment. We spent about 8.3 million Rwanda francs.
Miliyoni 8 n'ibihumbi 300 birengaho gutyo.
Dr. David Hachizimana is a neurosurgeon at the King Faisal Hospital specializing in brain and spinal surgery, and he explains what the condition is.
Hydrocephalus is a medical condition that is characterized by abnormally excessive accumulation of fluids into the ventricular system of the brain. So maybe to clarify some of the terms I'm using, like ventricular system of the brain, it's a system made by cavities inside the brain, actually in the core center of the brain, and those cavities, they contain fluid that we call cerebrospinal fluid, and that fluid is produced inside those ventricles, those cavities, and they circulate into those cavities where is a blockage of that fluid into the ventricular system. Fluid will be produced, then accumulated into the ventricular system, and that is going to produce excessive accumulation of the cerebrospinal fluid, that is hydrocephalus.
There are different types of hydrocephalus, which are communicative and non-communicative or obstructive hydrocephalus. There are also several known causes of hydrocephalus, as Dr. David explains some.
The other one is cerebral aqueduct stenosis. Cerebral aqueduct, it means a channel for water flow. So that channel is located between the third ventricle and the fourth ventricle. So that channel of fluid is a very narrow one, a couple of millimeters wide, 2 to 3 millimeters wide. So for some reasons, that very narrow channel can be blocked. We call that stenosis. In medical terms.
Hydrocephalus is the most common neurological condition with the greatest prevalence in low and middle income countries, and yet for many it's still an unknown condition, with many people still stigmatizing children born with the condition. People would see my child and outrightly point out her disability, and they said she wouldn't survive, saying that I'm wasting my money for nothing on treatment. Some said I should just give her 3 months and she would die, after saying children born that way never survive. Treatment for hydrocephalus includes acute phase treatment, where symptoms are progressing very quickly and causing significant brain damage, as well as chronic phase treatment. The treatment for hydrocephalus is quite expensive, yet Mutual doesn't cover the cost of such procedures, which has been a hindrance to most people seeking treatment for the condition.
Very sophisticated tubes, which one may cost $1,000 US. So not all Rwandans, they are able to, they cannot afford that, even if our health insurance helps them to get treated. But the 10% of that is a significant high amount of money that needs to be paid.
No known recent studies have been conducted, but it is estimated that hydrocephalus affects between 1 and 3 infants per 1,000 live births and has a prevalence of 4% in Rwanda. According to the World Hydrocephalus Association, there are approximately 200,000 cases of congenital hydrocephalus in infants around the world. Gloria Mutesi reporting for RTV.